ER doctors and nurses. Have any of your patients surprised you with their amount or lack of pain tolerance? Story 1. A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat with the patients. My friend was engrossed in talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After I put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside complain. When asked why he didn't say anything, he just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you." Then walked out. Don't make them how they used to. Spoke to my friend and I totally didn't do this story justice. The laceration was sustained in a machete attack. 2 guys tried to break into the man's house and one slashed at him, but he fought them off long enough until a neighbor started to run over and they scarpered. Such a relevant detail, how could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. Story 2. ER doctor here. In my intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail and causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating, the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked me in the eyes and said, "Doc, just take it off." Without anything? Yeah, it's fine. They fix our cuts without numbing medicine. But it's gonna hurt, a lot. You have to scrape. I know. So I went at it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was off, he was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. Story 3. Working as an EMT, I got called to a 64-year-old female who slipped in her house, possibly sprained ankle. When we got there, the woman is sitting in a chair with her legs stretched out in front of her. But she has long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all. So I figured this was going to be an easy trip. I kneeled down in front of her and took a closer look, and wasn't I surprised to find that it wasn't just broken, it was right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down, so what should have been the side of her foot was facing straight down, and the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at the moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles, very bumpy. Come to find out, she had multiple sclerosis, and that makes people feel pain differently. Story 4. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends, and all they saw was my slide and hit the wall. They came over and asked if I was okay. In a normal voice, I said I couldn't move my leg. No tears, screaming, or anything. No one believed me, but after a minute or two, I convinced them to call 911. The whole time I was waiting for an ambulance, about 30 minutes. I was talking to them normally, and no one believed I was actually hurt until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. They got out and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap, and the tops of the tibia and fibia were protruding out. They took me to the hospital. No in the ambulance, as I was joking around with them, i.e. asking if I'm allergic to anything. I told them, apparently, stone walls. They got me to the hospital and rushed me into the ER, and the doctors came over and were shocked I wasn't screaming or crying. Then, about an hour after the initial injury, the pain finally started once they started moving the leg about 3 doses of morphine, because one wasn't enough, and one of Demerol. I don't remember the next couple of days besides bits and pieces, but all the nurses and doctors told me I had one of the highest pain tolerances they've seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down because I was in so much shock and had so much trauma. Story 5. When my daughter was 5, she severed her ring finger in a door. I was making lunch for a picnic when she realized her teddy bear was in her room. You can't have a picnic without a teddy bear. She went upstairs to grab it when I heard a slam and one single blood-curdling scream. Then silence. I ran to see what was the matter, and my little daughter was sitting on the floor in front of her door, covered in blood and staring at something. She looked at me and said, "My finger is off, Mama." I wrapped her hand in a towel, picked up her finger, and called 911. In the ambulance, the paramedic was asking her questions about how much pain she was in, and she told him that it's the most hurtful thing ever, but she was sad that she ruined Teddy with her blood. They ended up being able to reattach the finger, but her Teddy was ruined. I tried to wash him, but it didn't come clean. The whole upstairs looked like a murder scene. I even washed the blood off the ceiling. A few days later, the paramedic knocked at the door with the biggest teddy bear I ever saw. He gave it to my daughter and told her that she was the bravest little girl in the world. And it was really sweet. Story 6. I had a patient, a 60-something male, who had 3 of his fingers mostly amputated by a snowblower at about the level of the second knuckle. He came in with his fingers hanging from skin flaps and was totally stoic. Not only was he a 0 out of 10 for pain, but his vitals were also rock steady. No alterations in heart rate or blood pressure. He kept joking around about it. Just cut him off. They'll grow back. This guy remained a 0 out of 10 for the entire time, even when they just cut them off. His biggest concern was getting out of the ER in time to watch a football game. Badass motherfucker. Stark contrast are the patients I get who scream bloody murder and cry when the blood pressure cuff is pumped up on their arm. Grown adults. Are you kidding me? Also, screaming and crying are only going to make your BP go up, causing that cuff to squeeze tighter and tighter. Story 7. An Eastern European guy had a circular saw accident that cut his leg down through the muscle. The wound was about 8 inches long. Was covering trauma surgery that night and got called down to sew it up. The ER had dropped him up, and I brought a med student with me, and I walked him through aggressively irrigating the wound, reapproximating the muscle, and doing a loose suture approximation of the skin. The student took some time and redid several sutures in the skin and muscle layers because there were too loose or tight, etc. After about 45 minutes, we were done. I asked the ER attending how much morphine he gave him so I could redose. He replied that he didn't order anything yet and was waiting for me. The patient's last dose was in the ambulance hours ago. I immediately asked the guy how he was feeling while I'm injecting the shit out of him with local. He said, "I feel fine." The guy didn't even flinch the entire time we were working. He was connected to a monitor and his heart rate didn't even budge. Story 8. When I was about 12, I fell on black ice and hurt my ankle. I knew it was bad, so I asked someone to call me an ambulance. I wasn't crying or anything when they put me in the ambulance. Paramedics told me, it's probably just a sprain. I get my x-rays and bam. My ankle was broken in 3 places and my foot dislocated. I saw the paramedic as I was leaving the hospital and he told me he thought it was nothing because I didn't make a peep. I did shed a tear about a week late because my leg was hurting. I get to the hospital and the doctor says, "We'll cut your cast off, but I don't think we're going to find anything." He leaves, the nurses take the cast off, and my entire leg is green, black, purple, blue, and I'm pretty sure some new colors that no one has ever seen before. Also had a bunch of pressure blisters. So the doc walks in, looks like he's in shock when he sees my leg, then leaves without saying a word. Then a new doc comes in and gave me a cool cast that I could take off to air out and look at my leg. The pain tolerance tends to f me over. Also, that doctor. Story 9. Not an ER doc or nurse, but I work side by side with an ER doctor. I saw an 8-year-old boy come in with a compound fracture to his left humerus, upper arm. The first thing I noticed was him strolling in, not a tear or grimace on his face, blood pouring down his arm, and a bloody rag held down near his elbow. The first thing I thought was he probably had a decent laceration to his arm. Pretty tough, but nothing too impressive. I get into the room and see that the rag was removed, and holy sh*, that's a bone sticking out of his arm. How the hell is this kid not bawling? How the hell did he just walk into the ER barely cradling his arm? Right then I knew this kid was tough. Little did I know that he was about to become Superman. So I'm sitting there admiring this gruesome wound and listening to his backstory. Apparently the kid was out with a friend riding a 4-wheeler when they accidentally drove into a ditch and flipped the vehicle. The kid was thrown and the quad rolled over his arm. This was about 4 miles out in the middle of nowhere over bumpy dirt trails. So of course he just jumps on the quad and rides the 4 miles back to his house with a bone sticking from his arm. Then his dad just leisurely drives him the 30 minutes into town to the hospital and strolls on in. The best part? When the doctor said that they needed an x-ray of the arm, he just casually asks, "Before you move it, can I get a little pain medication? It sorta hurts." Most bad 8-year-old I've ever seen. Story 10. I had a patient who was on his motorcycle with his child and was hit at an intersection by a drunk driver running a red light. Fortunately, it was right in front of the ER. The guy and kid get thrown off the bike. The guy got up, ran to his kid and picked him up, and walked in front of the door of the ER, maybe a block away. He got sent to me. X-ray pretty quickly and no pain meds had set in yet. It was taking the minor positioning I had to do like a champ and didn't really do more than a flinch. I quickly saw he had a mid-shaft femur fracture in one leg and the other's leg's tibia and fibula were completely shattered right above the ankle. And he had a calcaneus fracture and dislocated AC joint as well. Adrenaline can give you balls of steel. Also, just last night, I had a cop with both shoulders dislocated during an altercation. Yet, he managed to get up, relocate his right shoulder, and tase the guy twice before his shoulder dislocated again. He was in pain, but not anywhere near enough for me to think both shoulders were out. He's gonna need his mom's help for a while. Story 11. Not a doctor, but once I was bouncing at a club in a historic part of the downtown district where my college was located. Being in the historic district, the building had high ceilings and big, tall windows with thick, heavy glass. One night, some kids got upstairs and decided it would be a good idea to kick one of the windows out, right over the top of the crowded smoking patio out front. I felt a great weight come down on the top of my head and heard the sound of breaking glass. I thought, being that it was a pretty rough bar, that someone broke a bottle over my head. So I turn around raising the dukes and ready to fight when I feel what only could be described as my ear peeling off the side of my head. What had happened was, a shard of glass about an inch wide and over a foot long connected with my head at the topmost point of where my ear connected to my head, slid down through my ear canal and lodged in the back of my jawbone, making it impossible to close my mouth properly. I turned to my boss who was standing next to me, apparently because I don't remember this next part. This is what bystanders told me, and said, "Hey Mike, would you pull this out for me?" Went to the hospital, got stitched sans numbing aid, and made it back to the bar before closing for a beer. Story 12. Sorry I'm late for the party. I have so many. Working at a level 1 trauma center is awesome. We had a guy get his arm ripped off by some sort of tractor. He then drove this tractor to an EMS bay and asked them if he could get a ride to the hospital, or if they could take him back to his car since his tractor is too slow. Also had a guy fall down a ravine and fracture his tibia and fibula. He crawled up to his truck, used his shotgun to push on the pedal, and drove himself to the hospital. Had a girl fall on her steak knife during dinner. Came in 24 hours later because her cut wasn't any better, and she was afraid she'd need stitches. It was 6+ inches deep into her abdomen. She went straight to the OR. I think there's been probably 5 or 6 people I've seen who come in with MIs, heart attacks, and they're totally chill before any meds. I've learned the longer the problem list, the less they're able to rate their pain because even getting an IV is 20 out of 10. Which, by the way, the scale only goes to 10. So I made up a scale of my own since people can't seem to understand. 10 out of 10, you're actively being mauled and ripped apart by a bear. 9 out of 10, you weren't wearing a seatbelt and have been in a rollover accident at high speeds and have multiple broken bones, being shot through the abdomen or stabbed once. 8 out of 10, giving birth without medications or an epidural. For men, ureterolithiasis, kidney stones not in the kidney anymore, akin to swallowing attack. 7 out of 10, heart attacks, ischemic bowel, blocked blood vessels, essentially. 6 out of 10, appendicitis, cholelithiasis, small bowel obstruction, intussusception, abscess to the genitals. 5 out of 10. This is where most people experience pain at worst. I didn't bother going below this. Fibromyalgia is around here. Thought of one more. My least favorite case was one who passed away. Guy's car exploded on him in an accident, and his car was engulfed in flames for over an hour and everyone thought he was dead. He was alive and conscious and only rated his pain a 9 out of 10, despite having basically 90% burns throughout his body. Shortly after he decompensated, was placed on a ventilator and terminally extubated the next day. Story 13. Not the doctor or nurse, but when I was about 3 or 4 years old, I came down with something bad. My mother is a narcissist. Politely put, a rather selfish, emotional woman child. I was neglected for I don't know how long one time. I remember feeling sick and not eating or drinking. I eventually became so weak that I couldn't walk. Ma saw I wasn't responding to her and gave me a grape ice pop to try to get me to talk to her. I puked it up, still wasn't responsive. She got pissed about how withdrawn I was being and yelled at me. Got close enough to my face to feel the heat coming off of my forehead, so went and took my temperature. It looked like hell at this point. Raccoon eye circles, dry lips, and pale bluish skin. She freaked out when the temperature came back to 105 Fahrenheit and took me to a clinic, where they sent me to the ER and hooked me up to an IV to rehydrate me and made me stay in a hospital bed for a while. I had pneumonia and severe dehydration. I never complained or thought I was bad off. I sat blank-faced and limp for the whole ordeal. My veins were so tiny and the nurses stuck me a bunch of times and dug around to get it right. The outcome was horrible. To this day, grapes make me sick. I can go without eating or drinking to the point of starvation and severe dehydration unless I remind myself, and I had an incapacitating phobia of needles and veins. Another time I didn't go to the ER but was mauled by a horse that wasn't mine. The horse managed to pick me up with his teeth and threw me. I was rattled and dizzy but didn't really worry or feel pain. My left side was briefly paralyzed. I calmly got up off the ground and unlocked the gate to get out of the horse's stall, closed it behind me just feeling nauseous, and pissed that my left hand wasn't working. I called my mother so she could drive up and get me, as I had walked about a mile off to take care of this horse. She instead raged about how I had gotten myself hurt, demanded I walk back this instant, and hung up. So I made the walk back over the fields and through more gates. Didn't know how bloody and dirty I was. Once home, I realized my shoulder was bitten up and reluctantly let my mother see it. I told her my hand wasn't really functioning. She insisted I take a shower. Now once there, the arm started to ache a bit and feel uncomfortable. When finally at the clinic, x-rays came back and revealed that I had broken both my ulna and radius, clean across, as in about an inch of the ends were free. The only thing holding my wrist sort of in place was that the ends were shoved at an angle that made my wrist dip down. They put on the splint wrong and referred to me as a specialist the next day, since, hey, I didn't feel too bad. Ha ha. I was really sick the whole night, puking. I went to the hospital and the pain finally set in when they had to re-break my arm and set it to the opposite angle to make it heal correctly. Weird cast. I had my hand in some kind of swoop claw position for 3 months. Apparently I should have gone to the ER the first day. Story 14. Not an ER doc but a paramedic here. I had 2 calls within a month that showed a drastic difference in pain tolerance. It was August, so football practice is in full swing, and we get called to a high school for a leg injury. We get there and an offensive lineman is lying on the ground crying like a baby. His right leg is obviously deformed. He had a backward knee about 6 inches below his normal knee and in the wrong direction. The whole way en route he's crying, so I started an IV and gave him a painkiller and it never touched it. Now, a week later I get called to Pee-wee football practice for the same thing. We get there and it is another tib-fib fracture, but this one is open. Bone was sticking straight out below the knee and his leg below that was jelly. Kid was unfazed. He could feel me touching his toe and said it hurt, but not that bad. It was maybe 3rd grade and just wanted to look at the bone sticking out. He was telling me the whole way how he would have had a touchdown if he didn't run to that kid's helmet. Story 15. Not me, but my uncle. He was born with a hollow spot in his humerus, meaning he broke his arm very easily. Every time he broke his arm, the break was always at that hollow spot, and it would fill in a little bit every time it healed. By the time it was completely solid at age 17, he had broken that bone 11 times. This gave him an obscenely high pain tolerance. When he was 18 or 19, my uncle had a night terror and punched through his window. His arm was sliced up and bleeding from hand to shoulder, and according to my grandmother, he just calmly drove to the hospital with a towel wrapped around the cuts. When he was roughly 20, my uncle slipped getting out of the bed of a pickup truck and his knee caught on the bumper, which rotated his kneecap 180 degrees. He called my grandmother while she was at work. She was a nurse, and she instructed him on how to spin his kneecap back into place. It worked, and he never went to a doctor. When he had surgery to remove a tumor in his pituitary gland at 30, he convinced his doctor to let him leave after 1 day in the hospital, when the operation usually requires 5 days.